Every minute, 3 new cases of cancer are diagnosed in the United States. According to the Texas Cancer Registry, cancer is the leading cause of death for Texans aged 85 years and younger. However, many cases could be avoided. An estimated 50% of cancers can be prevented.
The screening rates here in the state are lower than average in the U.S., and in particular, the people in low-income uninsured settings have a significantly lower rate than the Texas average. Estimated that about half of cancers are those that have some component that could be avoided. So half of the cancers that occur in this country could potentially be prevented.
Which is why physicians like Dr. Foxhall urge everyone to get screened.
Many of these are related to cancer screenings, finding cancer early, where we get a much better outcome, but also primary cancer prevention, which involves areas such as tobacco control, managing diet, nutrition, physical activity, avoiding obesity, and being sure that people are able to receive the important immunizations that we know help prevent cancer.
Our programs are focused on how to improve the translation of what we know to be effective to those groups in order to help reduce their tobacco use rates, because we know, of course, that tobacco use is associated strongly with lung cancers, but also a number of other cancers and cardiovascular diseases as well.
The Cancer Prevention and Research Institute of Texas is making prevention services accessible to people across the state. So far, more than 5 million prevention services have been offered in all 254 counties. That includes 2.5 million education and training programs for public and professionals and 2.5 million clinical services.
We've been able to partner with CPRIT's help with groups that are federally qualified health centers. These are primary care clinics that provide services to low-income uninsured populations, and they work with us to provide the screenings to their patients. We then help them navigate to further diagnostic studies and on to treatment if that's necessary.
There's not a lot of funding to support what we already know works, but CPRIT provides that funding for us to take what we know is effective and disseminate it to communities who aren't being reached.